folks that just putting something out there that says, oh, we'll find you another place to go, means you're going to find us the right place to go, nor with the right patient population. I want us to be very sensitive to that.
All right, thank you. Rod, please, from the Board of Trustees' perspective.
So, 50 years ago today, I snuck away from my home out in Brandywine, Maryland, and went to my first Black Panther meeting at Prince George's Community College. Having gone to that meeting and lived much by the creed of the Black Panther organization since that time, which is about serving the Black community. Having been a member of this church right here for a long, long time and forged a relationship with Dr. Willie Wilson, who I want to take my hat off to for always being on the front line for the service of Black people and his church here. I want to follow what Dr. Mighty says, that we want to support our city leaders. And we want to support them and bring them to doing the right thing. I'm on the member of the Board of Trustees, and I think I need to maybe more say this as an individual who went to that Black Panther meeting 50 years ago. I'm extraordinarily disappointed that our city leadership and elected officials would ever think to have a hospital in a community that is overwhelmingly Black and not have the operation and the institution and the hospital that has served Black people year after year after year for 100 years. It is very important for the service to this community that it be provided in part by individuals who can come in here and look at that Last Supper with Black Jesus sitting there and to be able to identify everybody up there at the Last Supper. Howard University can and will do that. In addition to that, Howard University has a track record unmistakably of serving the least of thee and serving the least of thee when others would not. I'm going to stay away from specific examples, but Lord knows we can provide them for you if it were necessary. About Black people going to hospitals and others going to hospitals in other parts of this city, not having insurance, being told that they can't be served and to go over to Howard University. And Howard University took them in, treated them, and loved them back to health. That's who and what Howard University is. And for any consideration for there to be a hospital here that does not intricately and significantly involve Howard University is a dereliction of responsibility to the community where you're putting the hospital. Damn, I'm fired up like that, man. But this is third person. This is third person. So, let me calm down. Let me calm down. When we talk about equitable and just health care, when we talk about quality care, when we talk about cultural sensitivity, when we talk about cultural sensitivity, Howard University for more than 100 years has brought this to this city. And I implore everybody out there, everybody sitting up here to recognize that, put some respect on that, and as you proceed forward, find a reasonable, fair, and equitable way to include Howard University into the institution and to provide Howard University in a system where our citizens get treated by people who look like them and, more importantly, care about them. Thank you.
the students that are the focus of our conversation. And we have a medical student, Felice Williams. Did I say that right? Felice Williams. I just want to say, I know that Councilmember White is about to leave. His chief of staff is here, Wanda Lockridge. If there are questions that you will have for Councilmember White, I'd like for us to record those questions so that we can provide them to him so that you will have them, Councilmember White, at some other point. Does that work? Before Tuesday?
That's right.
Okay, all right. Thank you very much. Okay, and thank you for coming. I just don't want you to go without saying thank you. Felice?
Good evening. My name is Felice Williams, and I'm a graduating senior in Howard University College of Medicine. I'm here tonight because I want to talk to you about seats. So, Howard University has 120 seats per medical school class. That approximately means that about 80 people every year are admitted to Howard, and they're black, and they're going to be black doctors. And I'm one of them. And what I want you to know about that is that the way that seats are procured, for example, is that you have to have so many patient encounters, so many patients to see. You have to have so many faculty and facilities to provide those encounters. If you do not have those things, the number of seats you will have will be reduced. So, for example, with the current situation going on with this Health Act, 35% of the students at Howard University will not be able to get MDs because 35% of the patients that are currently being treated at Howard University and have been treated at Howard University for the last 150 years will be gone. So, how does that affect the larger scale of life? Well, if Howard University is the largest producer of black physicians, then that means that the largest producer of black physicians now has a chokehold on its pipeline to create black physicians for the entire country. So our responsibility, our outsized responsibility at Howard will be one that we will struggle to fulfill if we were to lose patient populations and were to lose our seats. Additionally, I don't just represent the students of the College of Medicine. There are also the students of dentistry, the students of the School of Pharmacy, both of which are the only schools of pharmacy and dentistry in the district. They will also have to encounter the same issue. We have subspecialty care in dermatology, we have subspecialty care in diabetes, in lots of different areas, and we also have residency programs and fellowships wherein in the country we're the only black training program that exists. Yet again, 35%. You lose 35%, that means instead of getting 3 dermatologists, you might get 1. You have a program where you're producing gastroenterologists, who are people that you need to go see get your colon cancer screening every 10 years after 50. We might not be producing those people anymore. These are the critical issues that have to do with seats. This is why we say things about academic affiliation agreements. The academic affiliation agreement is what will allow Howard to continue to have 120 seats a year. It's what will allow Howard to continue to be the pipeline for the education of black doctors for the nation. It's what will allow, 5- and 6-year-old children to walk in to a doctor's office and see somebody like me and say, maybe medicine is an option. It also allows for, it's also a place where we have a lot of really prominent black physicians. I don't know if you guys have seen online this week. We've had Howard Medicine Matters. We've profiled some of our prominent physicians. The first black female urologist is faculty at Howard. The first black female colorectal surgeon is faculty at Howard. These are important things that we have at Howard wherein black physicians are taking care of black people, and they were educated at Howard and they stayed at Howard. Like Dean Mighty said, where you train is oftentimes where you stay. So, those are the things that Howard has to bring, and those are the things that Howard continues to provide to our country. And I think that it's critically important that we not be left out of this act, and that we continue to push forward for inclusion.
I read the amendment on Friday, and I have not read anything that was developed from them. The top of my head almost blew off when I read what I read that said if Howard Hospital closes, then we'll find an affiliation. And my reaction to that is that's like a man dying and then you offering him some oxygen. So that part doesn't work, and hopefully that has been developed some. The last thing I want to say is this. I want everyone sitting in here, and whoever might see this on any kind of video or anything else, to know unmistakably that Howard University is committed from the top, from the Board of Trustees to the President to the administration to everybody involved in the process of there being a hospital in Southeast Washington that would give its community quality care. So much so, that members of the Board of Trustees have said to the President that if it is needed to monetize some of the assets that we have to help that process, that's how committed Howard University is to put some serious skin in the game. And I'll wrap up.
All right, thank you. I want to join me in thanking this panel for this really informative deep dive into the issue. When you all listen to I understand there are other people from Howard University here. Could we have all of the physicians and others who are from the hospital? Thank you.